Greetings all on World Homeopathy Day. Hi, I'm Dr. Saili Tilak. On 10th of April every year, we celebrate the birth anniversary of Dr. Samuel Hahnemann, who is the founder of homeopathy. Today on this occasion, we are going to discuss a very important disorder which is now an epidemic worldwide, that is diabetes. We have with us Dr. Sujata Naik, who will share her invaluable experience and knowledge about how homeopathy can help a person affected with diabetes. Hello, ma'am.
Hello, Dr. Saili. Greetings to you as well on World Homeopathy Day and to all our viewers too.
Thank you, ma'am. Greetings to you too. So, ma'am, I heard that India is now the diabetes capital of the world. So, is it true? And also that the diabetes is rise globally. Please share your views.
Absolutely true, Saili. India is now becoming the country with the highest number of diabetics in the world. There are two main reasons for this. I mean, there are almost 17% of the diabetics in the world belong to India. That's what they say. There are two main reasons for this. The first one being is that Indians are racially and genetically predisposed to high sugar levels. They have a higher glycemic index compared to the Western counterparts. I have always maintained over the years with my experience with patients that the glycemic index for the Indian persons or the Indian population should be different from that of his or her Western counterpart. Should be a little higher. For example, if 80 to 120 is normal, supposed to be the normal parameters for blood sugar fasting and post lunch. For an Indian, it could be say 90 or 95 fasting, and it could be 130 to 140 post lunch. Unfortunately, applying the same parameters has put a lot of Indians on above the threshold of the diabetes index. And that is why we have almost 77 million patients all over the world and 17% belonging to India. The second reason, of course, which is more important, is the change in lifestyle. Rapid urbanization, people moving from the urban to from the rural to the urban areas, more industrialization, more education, more white collar jobs have led people to sit at their desk and work through the day. So, with the result is that sedentary lifestyle, lack of exercise, and faulty eating habits have largely contributed to the rise in diabetes. Because type 2 diabetes, as is commonly known, the type of diabetes that we know is a type 2 diabetes, which is largely a lifestyle induced disorder. And that is why it is rising all over the world because of these reasons.
So, ma'am, is there anything which homeopathy can do? Like how homeopathy can help in diabetes and how it can help manage the disease?
That's again a very good question, Saili. Homeopathy has a huge role in helping patients who have diabetes. Now, let me tell you at the outset that homeopathy treats an individual with diabetes, not his blood sugar levels. So, for example, we treat constitutional homeopathy believes in understanding the patient's predisposition, why he got diabetes in the first place, what was the trigger point that made his blood sugar levels go awry. So for that, homeopathy will take your entire history to build your constitution, including your physical and mental makeup, your emotional predispositions, your life space, the kind of living conditions that you live in, the environment that you live in, the kind of food that you eat, the relationships that you have, the stresses that you have at work, and all these things, your past and family history also play a huge role in understanding your constitution. So based on this, a constitutional profile is made, and the remedy out of thousands of homeopathic remedies that match the constitutional profile of this patient. This remedy is administered to the patient, which is called as a customized or a tailor-made remedy for the patient. So unlike conventional medicine, which treats the blood sugar levels, so if your blood sugar is 140, you will get this medicine in this dose. If it's about 200, it is this. It's 400, you might be administered insulin. Homeopathy actually believes in correcting the natural healing process of the body which has gone wrong. And that is why it treats the predisposition, and that's the basic difference between the homeopathic approach and the conventional medicine approach.
Thank you so much, ma'am, for sharing that approach. It's definitely different in a way. So, can ma'am homeopathy cure diabetes with this approach? And is it possible to discontinue then the allopathic anti-diabetic medicines?
That's a hugely vital question which all our patients who approach us for diabetes treatment ask. Again, let me make it very clear that homeopathy is not about giving anti-hyperglycemic drugs. It's not that this remedy is this for this much blood sugar, or this is for if your blood sugar goes above this level. As I mentioned earlier, we believe in treating the predisposition. So while the conventional medicine is going on, there's a possibility that the patient is not responding in a satisfactory way. So the homeopath will try and get to the root of why the patient is not responding. What are the hurdles in his constitution, in his defense mechanism, that is not making him amenable to the treatment. So with the constitutional homeopathy, perhaps a patient who's already on anti-diabetes medicine, I'm talking about those patients. So such a patient, once he receives the correct homeopathic remedy, he will become more amenable to the anti-glycemic drugs, which will keep his sugar in control. However, homeopathic medicines are not a substitute for your anti-diabetic medicines. So please do not make that mistake. So if you go to homeopath, do not stop your earlier medication which is there. However, for patients who are newly diagnosed or who we have diagnosed, we will start giving them the constitutional remedy right away, and they have a better chance of complete reversal of their diabetes because they are not dependent on the drugs until then. Also, the lifestyle measures, the correction of those measures are administered and are advised right from the onset. So, combined with the proper lifestyle measures and the constitutional homeopathic remedy, the patient should be able to come out or get his diabetes completely reversed. This also applies to young diabetics. We see more and more young diabetics nowadays, and people literally 30, 35, before 40 are suffering from high blood sugar levels. So here we also, there's another homeopathic approach to this as well in advanced diabetic cases where the patient is on several drugs or perhaps on insulin and still not responding. Here, along with the constitutional treatment, we also have some specific homeopathic remedies which are known as organ specific. So we have some remedies which have an affinity to the tract which controls the sugar levels. For example, the pancreas or the liver, which are the endocrine organs which secrete, that the pancreas secretes the beta cells secrete insulin, which is responsible for controlling or managing the blood sugar, the glucose in the blood. So it actually helps to stimulate those and may perhaps increase your insulin, reducing the insulin resistance and help the patient get better with the homeopathic treatment. So we have several such remedies. Some of them are Cephalendra, Gymnema, Syzygium, Jambolinum, and acid phosphoricum, and several others which could be actually used as maintenance therapy as well to keep the patient's blood sugar in control.
Okay. So, ma'am, what I understand, so for these patients who are suffering from diabetes for a long time, they must be having some complications of the diabetes as well. So, how can homeopathy help in those, and what kind of complications?
They say diabetes and hypertension are going to be the nemesis of this generation of the current century. And they literally come with softly padded feet without announcing that I'm here. So diabetes doesn't have its own symptoms, but the symptoms of the organ that it affects. So very often you see that untreated or mismanaged diabetes, which I believe very strongly, is that mismanaged diabetes is worse than untreated diabetes. So when you're diagnosed with a high blood sugar, please don't rush to anybody and just take any kind of treatment. Visit your doctor, go to a proper endocrinologist, get your treatment set well, and perhaps they will advise you drugs only after they are ascertained that you're a full-blown diabetic. Until then, don't rush into remedies and don't think that eating bitter things is going to neutralize your blood sugar. But speaking of complications, is that the most common complications associated with diabetes are mostly skin-related ailments. Very often the patient will present with recurrent boils or abscesses or non-healing wounds, and until then they perhaps may not know that they have high blood sugar levels. So once you check, you realize that he's probably his sugar is above 300 or 400. So the skin issues could be just an indication that the blood sugar levels have gone awry. The other thing could be generally neuropathy. So a lot of diabetic patients suffer from what is called as peripheral neuropathy, numbness and tingling in the limbs, and that's because diabetes affects microcirculation. High blood sugar levels will affect microcirculation, which will affect the functioning of the nerves of the periphery, especially your upper and lower limbs. So you can experience numbness and tingling. Diabetic nephropathy, because diabetes has a the biggest complication that every doctor and every patient is concerned about is the effect on the kidneys. Kidney dysfunction is one of the most common and the worst complications of diabetes that you can ever imagine, and that's something that has to be treated, mostly prevented. You have to prevent it if possible. So once the creatinine goes above a certain level, you know that the kidney is damaged beyond say 40 or 50%, and sometimes it's irreversible damage. So this is diabetic nephropathy, something very important. All those patients with diabetes which has been uncontrolled or which is not managed will also have issues which have stronger affinity or stronger chances of developing cardiovascular issues, especially heart disease or brain strokes, and this is something that has to be kept in mind. It's very important. So the sugar should be kept at an optimum level. It's not necessary to bring it down absolutely low, but it has to be kept to a normal level. Remember, hypoglycemia is another big complication of diabetes. That is absolutely low blood sugar levels, which make the patient dizzy, and then he has to take some sweet. So this kind of cycle keeps continuing. The patient takes sweets because he experiences low sugar, he experiences the low feeling, dizzy feeling. So he takes in more sugar. That spikes up the blood sugar levels. His blood sugar reports are going to show a spike. So the doctor will advise more medicines, and the cycle just doesn't end. So we have to understand why this is happening in the first place, treat it at the outset, and that's how it happens. There are several other complications as well. Diabetic retinopathy is one of them. Diabetic foot is one of the things that we have to be very careful. But obviously these are complications. Once they set in, you have to consult the concerned specialist. But homeopathy has definitely a lot of constitutional treatment as well as indicated remedies which can help the particular organ specific issues.
It's good to know, ma'am, that homeopathy can help in complications of diabetes because it makes it fearful in a disease. And this leads me to my next question, that is, for someone who is not suffering from diabetes but is at a very potential risk or a high risk, that is someone who has a family history, a strong family history of diabetes, as diabetes is known to be hereditary. So can you homeopathy help such a person?
That's a wonderful question indeed, because this is something that we often face in our practice very, very often. Patients often approach us saying that, oh, my grandfather, my grandmother, my paternal aunt, uncles, and my parents have been diabetics all through. Some of them have, suffered so much that they had to be put on insulin. I have 3 siblings, 2 of them are already diabetic. So what can I do? I'm not diabetic now, but is there something you can do to help me? Now, this is a very vital question. So, can you start treatment as a preemptive measure? But that's not really how it should be, because giving anti-hypoglycemic remedies at the outset is not going to help the patient, because they will only help if his sugar spikes. So the thing is that it's like an alarm bell. It's a red flag, and which you have to watch out for. So monitoring the patient's blood sugar levels, if there is something negative in his lifestyle, that needs to be corrected. Also remember that not every person who carries a gene for diabetes will suffer from diabetes. There has to be some trigger, and stress is one of the major triggers. Your mental makeup, your mental constitution predisposes you to these lifestyle issues. So when a person says that, oh, I have been eating junk, or I sit up late in the night watching movies and with my popcorn and my soda on the side. So we do advise them to stop it, but we understand why that tendency has occurred in him in the first place. Why is it that he wants to have soda and popcorn at night? Is he lonely? Is he upset? Is he stressed? So these are the factors we will target. And the constitutional remedy is meant to correct that. So we often see patients who say, oh, I've never exercised before and leading sedentary lives. But once the constitutional remedy is given, they will come back the next time and say, oh, now I've joined a yoga class, or I have started going to the gym, or I've started my walks. So it's not just his willpower. What has made his willpower come back? So this is the role of the constitutional homeopathic remedy, to bring back on track, to restore the equilibrium that has made the patient predisposed to that particular condition. So in a hereditary situation also, if there's a strong family history or a genetic predisposition, we'll monitor the patient, give him lifestyle advice, and perhaps administer him a constitutional remedy based on all that, which can actually help delay the onset of diabetes in his case, or even if he gets it, perhaps not make it as severe or bad for him as his predecessors.
So, ma'am, can you share with us some tips, lifestyle tips for how to manage?
Oh, the internet is full of tips for diabetes, right from karela ka juice and all kinds of concoctions to
Yeah.
reduce blood sugar level. But my suggestion to the viewers would be is that please don't fall prey to anything that you see on internet or on social media. Please keep your doctor in the loop, because diabetes by itself doesn't mean anything. It doesn't do anything. It's just a reading. What is important is what it is doing to you. What has happened to you that has led you to have your diabetes. So these are so if there is a direct connection between your lifestyle and your blood sugar, you must correct that, obviously. But sometimes there may not be a correction. We see so many people who are non-alcoholics, non-smokers. Again, these are factors which predispose you to sugar, high blood sugar, especially high blood pressure as well. uh, Even then, even when the patient does not have any of these risk factors, even then he still has a high blood sugar. So we have to understand what is it in his mental and his physical makeup that is making him predisposed to that. So we give advice on that, and then of course a general dietary and lifestyle advice regarding that you must eat small meals. Even if you have a 9 to 6 or a 9 to 7 or a 9 to 8 job which is sitting all the time, you can still find time for exercise. Remember that some exercise is better than no exercise. So even if you can't make it every day, whenever you can, go out, walk. Walking is the best exercise for diabetics, because that will bring down your blood sugar level like anything. So this is extremely important. So you don't have to go to the gym. A little bit of yoga and walking every day for about 45 minutes at the stretch, brisk walk, is going to keep your blood sugar levels in control. Also, little stress management. Find about 15-20 minutes of the day to do something you like, whether it's reading, music, painting. Develop parallel activities. Don't just be after your work. And just stress management techniques are the best way to reduce those cortisol levels and the stress hormones, which again predispose you to high blood sugar levels. So doing all that, and of course healthy diet. By healthy diet, you need not give up your favorite foods, but you need to prioritize. You have to give up everything that is damaging, everything that is a direct form of sugar. That is something is absolute no. And of course, you can still enjoy life.
Yeah. Thank you so much, ma'am. I'm quite sure all the viewers must have cleared their doubts, and thank you for those valuable tips. I'm quite sure that all the viewers will also understand how homeopathy helps in diabetes. So thank you all for watching the video. Please do subscribe.
Thank you very much. Wishing you all a very happy homeopathy day.